By 2050, the U.S. Census Bureau projects that the number of non-Hispanic whites will fall, the number of African Americans will have grown by roughly 30%, and the number of Hispanics by 60%, and the number of Asian Americans will have more than doubled. When treating and working alongside people coming from different backgrounds, healthcare workers must have an understanding of how to operate cross-culturally. How do we ensure that this is happening, you may ask? It starts with each one of us, and cultural competence is the term associated with it. Cultural competency is the ability to distinguish similarities and differences across cultures while also being able to adapt and apply appropriate knowledge depending on the circumstances. In a previous video, I explained 5 benefits of cultural competency. Let's talk about 5 more reasons why cultural competency is important in the healthcare industry. 1. Increased patient safety. You may be thinking, did I hear that right? The whole purpose of seeing a doctor is to make sure that patients are being taken care of. But errors or accidents can and do occur in the medical field. We will go into depth on this a bit later when we are talking about healthcare disparities. Through awareness and an understanding that not all patients can be treated the same way, cultural competency reduces the risk of errors and accidents. It can also reduce the impact of the error if it were to occur. 2. Reduced conflicts. Setbacks such as language barriers, misunderstandings, and unconscious biases occur between coworkers and patients alike. A culturally competent person is able to diffuse the situation by not letting it escalate or turn into a conflict. Cultural competence doesn't mean that you have to adopt another person's set of values as your own. Instead, you're able to approach them in a non-judgmental way and express a desire to try to help them and not change them. 3. Reduced care disparities. Healthcare disparities are differences in accessibility to healthcare services as well as variations in rates of disease occurrence and disabilities for specific populations based on socioeconomic, preventable characteristics. Health disparities take on many forms for racial and ethnic minorities in the United States. Disparities may look like access to care, poor quality of care, or community features. When someone is culturally competent, they're aware of healthcare disparities and make efforts to increase health equity. Health equity exists when everyone, regardless of their race or ethnicity, have the opportunity to experience their highest level of health. 4. Saves time. Conducting research on how to better cater to specific groups assists you in learning how to allocate healthcare resources and workers' time wisely. Effective communication and knowing how to dispute misunderstandings and conflicts also saves time. 5. Saves money. We've all probably heard the phrase before, time is money. More time spent being culturally competent leads to monetary benefits. Knowledge and knowing how to assess situations in the healthcare field ultimately leads to saving money. Understanding other cultures benefits patients or clients that you're seeing, and it helps you to better understand people in your workplace as well. It gives you greater knowledge of how to approach situations and treat people accordingly. If you'd like to learn more about cultural competency in the healthcare industry, click the link in the description to this video or reach out to eTactics. And you already made it this far into the video, so you might as well like it, share it, and comment below.